My name's Alia. I'm a licensed midwife and a certified professional midwife, and I'm the owner of Kinship Midwifery in San Luis Obispo, California. And I attend home deliveries, birth center deliveries every now and again, and I don't deliver babies in the hospital. Home birth looks like childbirth at home with a skilled provider. I think one of the most common questions I get when I'm doing a consultation is, what do you do in the case of an emergency? And I think a lot of people believe that midwives are there for when things are normal, but when they're not, then we just automatically go to the hospital because that's what it's there for. And sometimes, yes, that's the case. But we do carry equipment in medicine. Our license permits us to order certain medications, antibiotics, and anti-hemorrhagics. We carry oxygen in case we need to resuscitate a baby or a mom. And so we do treat with medicine when the time calls for that. Although our core belief system as midwives is that childbirth usually doesn't need medical intervention. So we kind of have that on the back burner just in case. So the California State Medical Board permits us as licensed midwives to care for women or birthing people that are of low risk status. So about 92 to 94% of the population in America are considered low risk pregnancy, which means it's safe to assume that their delivery should be straightforward unless a complication were to arise. Some things that risk you out of care for a home birth midwife are things like gestational diabetes, preeclampsia, placenta previa, or any serious underlying health conditions. Us as licensed midwives, I think we all really pride ourselves in the aspect of risk assessment. So another myth that I've heard a lot of the time is, or the question I get is, do you do blood work? Do you do ultrasounds? Do you do genetic testing? Do you offer that to me and my family? And the answer is yes, we do offer the standard of obstetrical care. It looks similar as far as the schedule of visits go. If you were seeing an obstetrician, we see you the same amount of times. We offer just about the same amount of tests. And it's part of our pride and joy and our job to risk assess to make sure that you and your baby are safe for out of hospital delivery. I think another kind of myth that's arisen over the years is, are midwives licensed and trained, or is it just kind of because we're not doctors? Is it just someone who comes to my birth when I'm in labor? And we are licensed by the Medical Board of California. We are trained through a specific midwifery apprenticeship and a midwifery educational program that has very high educational standards. And we have to pass what's called the NARM board exam. It's the same board exam that certified nurse midwives in the hospital have to pass. And that's how we obtain our credentials as a midwife in our state, at least, of California. A lot of the time, we believe that childbirth is innate and it's primal, and it shouldn't be medically intervened upon unless necessary. I think that's part of the reason why we're seeing such a rise, not a fall, in our maternal mortality rates in the United States is because of the amount of medical intervention that we have in this country in the area of obstetrics. About 32% of women, so that's about 3 in 10 women are having a C-section, so a belly birth, we like to call it. And that's really high. That's a really high cesarean rate. Women that plan birth with a licensed midwife or a certified professional midwife have about a 94% success rate for vaginal birth. And then those that are planning a home birth with a midwife who have had a previous cesarean, so they're attempting a VBAC, have about an 87% success rate of a vaginal birth with a midwife. It's very different if you're in care with an obstetrician. And so I think as midwives, we feel really strongly and really passionately about natural birth, that birth is not a disease, pregnancy is not a disease. It's a natural bodily process that needs to be respected, and we are really fighting hard to change the obstetrical practices in our country. And our statistics are showing that we are doing wonderful things. So I hope that answers some of your questions about home birth midwives, what we do, who we are. And if you have any more questions, you can always contact